there's been a tremendous amount of activity to deal with the affordability of care issue. How can we get the costs down? How can we rejigger the delivery system so that there's real value based around outcomes? And a lot of what has happened in that regard is an enormous amount of transparency and data analysis about who's receiving care where, what it costs, who's paying what, and that's really changing the landscape a lot. Hospitals and physician groups who charge more, who perhaps have market clout and have been in a good payment position are under enormous pressure to get those costs down. Lower cost providers are feeling a real opportunity to level the playing field. And we almost have speed dating going on among our hospitals and physician groups in terms of partnerings. Hospitals are partnering with health plans. Community hospitals are getting together in small systems. Academic medical centers and community hospitals are getting together. Most of all, physicians are moving around. Physicians are increasingly taking risk-based payment products that are designed to pay better for outcomes and not volume. And as they, particularly in the primary care arena, take those products, then they look for who is the lowest cost provider who can give me good service and good outcomes. Good news is that we are bending the cost trend very dramatically in Massachusetts. If you adjust a family premium for insurance to the U.S. median, Massachusetts is 48 out of 51. It's 30% more expensive to live in Boston than the U.S. average, so of course our premiums and our cost of care is going to be higher, but when in just 1 year, Massachusetts dropped from number 1 in terms of absolute cost, all in, to number 9 in just 1 year. Also, in terms of hospitals, part of this was driven by the recession, of course, but just in 2 years, hospitals took $2.7 billion out of their projected cost increase. First of all, Massachusetts hospitals have never had great bottom lines. Our median operating margin for the whole Commonwealth is 2.2%. You know, you really want even 3% to be sustainable. And that's one of the reasons, and that has worsened over the last few years. I think it's unrelated to what's going on. It's a sign of the times. We actually see the ability to take costs out of the system and to redesign the delivery of care as the only hope for hospitals and physicians to have better margins. Because if they can get rewarded for better outcomes and better quality, if they can quit doing some of the things that are excess care, unnecessary, or duplicative care, then perhaps their margins will actually be better to make investments in care for patients. The biggest lesson to be learned, you have to have a collective will. You have to have health plans, physicians, and the business community, and hospitals who are willing to work together with government as a partner to move this transition and not have your head in the sand and not be fighting it. Consumers are being put more at risk personally. Employers are designing plans now that have higher out-of-pockets and deductibles and things like that. So they're paying a lot more attention to where they get their care. One of our state's largest health plans just announced a narrow network that includes 50 hospitals and some 16,000 plus physicians that is priced 10% lower than what their prevailing rate is now. They left out high-cost providers of all kinds, both community hospitals and academic medical centers. So it will be interesting to see how patients respond to that. But people are walking, and they're walking with their phones and their fingers, and they are looking for more affordable places to get care. What's really important is that we, though, are very transparent about the quality measures, and people are still getting good quality.